Thank you very much for the invitation for this presentation. I will talk about COVID-19 in North America. Just very quickly, these are some potential disclosures from my side. And after the emergence of SARS-CoV-2 COVID-19 in China, for us in Latin America, it was evident that there was the possibility, a certain possibility that this will arrive. And we were expecting the arrival of this SARS-CoV-2 COVID-19 in Latin America. And certainly after the spread in Europe, North America, in Latin America, it was evident that this will be a reality. And particularly in the case of what occurred in Europe, but particularly in Italy, as we discussed in this publication with Cecilia, Ranjit, and Kihiko that are present in this meeting. In fact, most of our first cases here in Latin America arrived from Italy, and that was the case of Brazil, that was the case of Colombia, and many others that received cases not only from Italy, but also from Spain. But it's important to mention that here in Latin America, there were different epidemiological important situations in terms of the moment where the COVID-19 arrived to the region. Many migration crises, many epidemics of dengue, many epidemics of measles, among other, had been highlighted, different publications we have made. But also here in Latin America, it's important to mention the importance of the cultural issues that were initially related also to different implications in the transmission during the first weeks of the pandemic. Particularly the last year in some countries, especially around October, was very important. This situation that was the case of Brazil, Peru, Chile, Mexico, but also Colombia that faced important peaks in this pandemic of COVID-19. Right now, the numbers are quite low in Latin America, but still we are expecting to see what will happen in the near future. In this time during the pandemic, since the beginning, we start to assess the impact of the clinical presentations from our first cases that were confirmed with the infection due to SARS-CoV-2. But also it's interesting to see that we developed this kind of other publications, such as the case of systematic reviews with different colleagues in different countries in Latin America, but also with the collaboration of some authors from Japan, as Hiroshi Nishura, as Hiromitsu Kataoka, but of course the case of Ranjit, among many others. In Latin America, the situation is important, also very variable, not only in the terms of the incidence, but also in the impact in terms of the case fatality rate. Right now, we are expecting to see what will happen in the near future as concerning we are seeing is happening, for example, in countries such as Germany or United Kingdom, but still we have to see what will be happening in the future and if again, new peaks related to this will be happening. In the case of the region, countries such as Brazil, as I mentioned, has been one of the most important, but here also in Colombia, we face different peaks in the incidence, in the number of deaths, and it's important to highlight the impact of the process of diagnostics for the SARS-CoV-2, as well the genomic surveillance for the detection of the different variants of concern, alpha, gamma, delta, but also here variants of interest in the case of lambda and mu. And right now, it's important to begin to mention our monitoring, not only for them, but also with the new variant of concern that, you know, has been recently today classified by the Committee of the World Health Organization, the new variant of concern, Omicron. In terms of the epidemiology and the clinical evolution, it's important to mention that most of our cases occurred in young population, and these fortunately had a difference regarding those that died, that were particularly those with high risk factor in elderly. Most of our cases recovered, especially at home. Unfortunately, there has been also an important appliement of current guidance, as occurred not only in US and developed countries here in Colombia, developed evidence-based guidelines, and this has been a very important aspect for the management of the patient with the SARS-CoV-2 COVID-19. It's really important to highlight the research, as I mentioned, and the participation of our colleagues here in Colombia, Latin America, in different studies and clinical trials, as the case, for example, of the Solidarity published this year in the New England Journal of Medicine. But at the same time, important situations for our region, as I mentioned, the case of dengue, that even has led to the possibility not only of co-circulation, but also more than 4,000 cases of co-infection that, for example, here in Colombia has been already confirmed. Then the importance of the differential diagnosis for the tropical fever syndrome has been important. I would like to finish speaking about the vaccination, which has been important in terms not only of the promotion, but it's important to assess what is happening in terms of the intention of the vaccination in order to increase the figures and particularly the population that has been fully vaccinated. Finally, lessons learned, many, not only the importance of the evidence-based guidelines, but particularly many other related to the health system are quite important to remember. And I would like to invite you to visit and to read our editorial at Frontiers in Tropical Diseases, where we discuss that. To finish, I would like to invite you to our website of the Colombian Association of Infectious Diseases, where I am currently the president. And finally, as the poet Luciano Garcia Gomez says, here in Pereira, there are no foreigners. We are all Pereirans, and that applies widely for Latin America. Thank you very much for your attention.